We've been doing Ask the Doctor segments for a long time, and rarely does a question make us stop and say, wait, what? Like this one did.
I have arms that are on sideways from the elbow joint down. I can't turn them around, and it prevents me from doing certain things. I've always wondered, are there other wonky armed people walking around, or is it just me?
Kelley is now here along with orthopedic surgeon Dr. Raj. And, okay, Kelley, just because I haven't heard a question like this, tell us what you mean by sideway or backward arms.
Okay, so my entire life, my arm has not had the ability to have a complete range of motion. So from here down, it's rotated, and if I try to turn my hand up to the ceiling, I can't do it. It just stops right there.
So you cannot do this?
No, I cannot do that.
How far over the other way can you go?
I can go a little bit further.
Yeah.
So for example, I can't take change. Somebody hands me change, I can't take change. I have to use a coin purse. Or I can't hold a tray. If I want to hold a tray this way, I have to sort of turn my whole body to compensate.
Any pain at all?
For example, if I'm on the phone, if I'm holding my phone for a while, then it'll start to get a little bit sore and tingly in my fingertips a little bit. But other than that, not a lot of pain.
So Dr. Raj, what's going on?
Very good. So let me have a look at your arm, Kelley. So first thing to notice is their carrying angle. Her carrying angles, it's what we call valgus. This is normal, and this is off by a bit compared to the average population.
Well, you know what? It sounds to me like part of this is you're just special.
Well, let me give you,
what I mean by that is, it sounds like, as an orthopedic surgeon, when you see someone with hypermobility, you got to rule out these systemic things that can be really scary. In a case like Kelley's where, okay, let's just say this is isolated, does Kelley just say, okay, I have to live with this now? Is there anything she should be doing?
Well, here's the deal, and you are special in that way. And
unique, and all these good things.
They broke the mold.
And guess what? I see a lot of this, so you're not too special in that sense. In a good way. Nothing to worry about.
Come on, Dr. Raj.
Nothing to worry about, okay? What you worry about is pain and symptoms that come about. So, for example, if you start getting pain or too much numbness and tingling, you see this angle? We've got our ulnar nerve going on this side. If it starts going too much, you start getting numbness and tingling, losing grip strength, that's where you come to an orthopedic surgeon for correction.
And I think the takeaway for anyone watching is if you notice abnormalities in your joints and you're a little bit off or different, you start to develop pain, get it looked at sooner rather than later, because in some cases, there are things that need to be done. But in your case, it sounds like, Kelley, you just got to keep being special and unique. And as long as you don't have pain, Dr. Raj, she's good to go?
She's absolutely perfect.
Thank you.
Thanks for sharing, Kelley.
Knowledge is power.
Thank you very much.